Dr. Emily Abel is an OBGYN physician for Avera Health in Brookings, and she sees women for Pap tests.
A Pap smear is a brush technique of collecting some cells from the cervix to be able to screen for cervical cancer or precancers of the cervix.
As Dr. Abel said, they're important for catching precancerous or cancerous cells early.
Because when they are detected early, then we have treatments that we can use to get rid of it and watch to make sure that it stays away. But if we are not doing them, then we have the potential for a not nice cancer to creep up and cause us problems.
She is talking about cervical cancer, which is the second most common cancer for women in middle to lower income countries. Dr. Abel says the past 10 years have changed for the procedure of Pap smears.
The shift has been from annual exams where we get Pap smears to based on what the risk level is, based on what the Pap smear results are. So the ones that come back abnormal, then we increase the frequency of how often we get those Pap smears. And if everything continues to be low risk, then we space those out accordingly to the guidelines.
Dr. Abel says women start Pap smears at the age of 21 and get checked around every 3 to 5 years, although some are checked yearly. They stop at 65 if everything is normal.
So if someone has abnormal Pap smears, then we may need to continue those further on past 65, but most people who have normal Pap smears are able to stop at 65.
Around age 30 is when OBGYN physicians, like Dr. Abel, check for HPV along with Pap smears. She says HPV is the cause of cervical cancer, and a game changer that came around the mid-2000s is the Gardasil shot, which is a vaccine to HPV.
Gardasil protects against a number of different HPV types that cause cervical cancer or things that predispose us to cervical cancer. And so getting that vaccine helps prevent people from getting cervical dysplasia or abnormalities, precancers, as well as cervical cancer outright.
She says the women who are in their 20s and early 30s should have gotten the shot in their teen years, but she says there is a way for women who haven't gotten the shot to catch up.
If you didn't get it on time, then it's a 3-dose shot. So you get it on whatever first day, and then 2 months later, and then 4 months after that is the series that we do, and that should help protect.
Men should also get the Gardasil shot, as Dr. Abel says HPV can cause other cancers like throat cancer, penile, and anal cancer. But for women, Dr. Abel says they should continue to get a pelvic exam during that break in between Pap smears.
Generally, I still recommend that we do at least a pelvic exam to feel ovaries because those can creep up on us a little bit more insidiously, and so definitely want to be able to feel those as well. But as long as people are asymptomatic, then we can wait until the recommended guidelines say.